Hey everybody, welcome back to the EQN Sports as driven by Holiday Auto Group. I am here with Trudy Gage, and Trudy, we've just been sitting up here chatting. You represent a pretty cool company.
Thank you.
That kind of takes care of our horses. Just kind of, in a huge way. So first of all, thank you for being a big part of the NRCHA, and as we will learn here in a second, a huge part of the entire Western industry, or not even the Western, the horse industry. So let's talk a little bit about PulseVet, Shockwave, and then we're going to get into, you guys got a lot of cool new things coming out too, but
yeah.
let's talk about it. Tell me about it.
Sure. So PulseVet Shockwave is a non-invasive regenerative option. It's a sound wave. There's no shock, so it's a little bit of a bad name.
Sure.
It's a sound wave that helps our horses and dogs, humans. It's FDA approved for some things, even in humans, to treat injuries. Started off tendon and suspensory injuries,
sure,
and that has expanded to many more indications.
Yeah. So you guys, there's a lot of people that try to do. We all know the deal, right?
Yeah.
If you've been around it, you've seen it. But you guys are very, very special because everything that you do. Talk about all of the testing, all of the approval. There's no more legitimate. You guys are legit because of everything you've done.
That's true. So there are a lot of knockoffs popping up. That's what happens, right?
Sure. When you're successful, that's what happens.
Yes. How does that go? Imitation is the best form of flattery, or
100%,
something like that?
100%. Yep.
Yes. So maybe I should be flattered.
Right.
However, my friends all own horses.
Yeah.
I want to protect them. And everybody that's spending their money when they go to treat their horses. So some things I think is important to know about the PulseVet Shockwave, which I've been with since 2009. So it's near and dear to my heart for sure. But this is a product that's made in the USA. That makes it a little different. Check mark. It is the only shockwave on the market, electrohydraulic focus shockwave on the market, that has 2 decades worth of published studies, clinical research, and science. Those things are very different from marketing. We are a little light on the marketing. We're very heavy on the science. I have a team of professional service veterinarians that work here. We continue to support and do the research. That's very important to us, that it's safe and effective. So you'll see if you look, and please do, go to PubMed, go to places if you're going to choose something for your horse, know what you're paying for.
Sure. If
you walk into the vet clinic and they say, we're going to shockwave your horse, you might ask a couple of questions, right? Because it's a little bit like the Rolex watch story. Here's the real one, and we know what it does, and then here's a fake one, and they look a little the same, but they don't work the same, and they certainly shouldn't cost the same. So be sure you're not paying for those things. Don't pay knockoff. Don't pay a designer price
for a knockoff.
Because you cannot expect the same results. And in fact, because they lack some science, we do now see some evidence, some published studies showing a possibility of potential damage. So be careful what you're doing. And what you're using on your horses. Number one is the horse first, right?
So talk to me as a competitor.
Sure.
As a competitor, I have a horse that, whatever it is, tendon, suspensory, the things that we all deal with all the time, right?
Right.
Those things that we deal with constantly.
Yes.
Talk to me about, I'm gonna go in, what does this do? Is it regenerative? Is it inflammation? Talk to me about all the things.
Sure. So there are a few categories where we have published studies that I can refer to.
Okay.
Some of those are in tendon ligament healing, and that is what put us on the map. And if I can tell you quickly, how that works. If you have a horse with a tendon injury, right, they were so hard to heal. And the reason for that is they lack blood supply, right? So they get very difficult to heal. The sound wave, and in our device, we have 4 separate, we call them trodes. Okay. And that is what we use to reach the depth we need. If you're treating a sacroiliac area, a horse with kissing spine perhaps, or you're trying to treat a splint, we know those are very different depths, right?
Gotcha.
So our particular device, and is the only one, that has 4 different penetration depths that the vets use when they're treating
specifically for that.
Correct.
Gotcha.
For that depth, right? So to get to those tendons, which is what put us on the map, which is why we got the insurance coverage 2 decades ago. Most equine medical insurance companies cover this. There's a reason for that, and it's not marketing, right? It's science, and we've proven that it's safe and it works. So if we can bring the blood supply to those tendons, well, excellent. We can actually really help them heal faster. What also happens is a very powerful anti-inflammatory effect. So now, because we brought in that new blood supply that created brings in all the things we want, the healing factors, and downregulates some of those bad things that we don't want. So that's great. So with the anti-inflammatory effect, we get an analgesic effect. So now we're helping manage that horse's pain. So if we can do 3 things, bring blood supply, actually shorten the healing time, and manage that horse's pain without needing to prescribe an NSAID, where we know we have to then worry about
Their guts
ulcers and GI.
Sure.
Well, that's a win. So that's where it started, and most of the vets that have been around it for many years, that's all they used it for. Now, tendon ligament healing, bone healing. It's great for your dog with arthritis. If you don't want to give all of those pharmaceuticals, Colorado State University published a great paper on bone healing. The University of Tennessee's rehab program for dogs now, because that's your other best friend, elbows and back pain. Tufts University on shoulder lameness. Dog owners don't realize yet that this is an option, but it's the next place we're going with it, because I don't want to give my dog those pharmaceuticals because they are doing other things. So I'm sorry, I got off track.
No, you were right on track. It's fascinating to me that we're talking about something that is non-invasive at all.
It's very safe.
It's very safe. We're promoting blood flow. Bottom line,
yes,
we're promoting blood flow, and you guys have got it dialed in over the last few decades of doing it. And I love that it helps our canines, like the dogs. We all, everybody that has a horse has 10 dogs, or vice versa. You know what I mean? So helping them, the blood flow promotion is where we all know. If you know anything about science at all, that's where it starts, right?
Yeah.
Right.
Yes. So, and if we can eliminate inflammation, everybody feels better.
Yeah.
Right? So the performance horses, maybe they don't have an injury, but boy, oh boy, tomorrow night, we want them to be feeling their very best, right? So often it'll be used on the glutes, the hamstrings, maybe the lower back. The top line is a great place to use it. The necks, the pulls, they get sore just like we do. They're athletes. This is a way to help get that inflammation out, increase the elasticity, and just make them feel better and cause no harm. The worst thing that could ever happen using the shockwave is nothing. That would be the worst case scenario. But
worst case is nothing.
Yeah, but you know what you're not going to get? You're not going to get a flare in a joint. You're not going to damage a joint. You're not going to get any local reaction site. You're just never going to do any harm. And we know that the insurance companies wouldn't agree to cover it if it wasn't actually working. It's very proven to work and be safe.
Yeah, or you do it. You use an NSAID like you were talking about, and then you're right into fighting your gastro stuff.
Yes.
So then, which is a whole other deal that affects their mind and everything else. So great. I love this. So this is preventative maintenance. This is maintenance. It's the whole deal.
And when you have an injury. Recently, which is exciting, the metabolic horses, right, we're learning more and more and more about the importance of protecting those horses. We have just completed in the last couple of years and was presented at the AAEP conference this year, 2 new areas, 2 new indications, and one of them is great for those metabolic horses. We're treating very effectively asthma. So horses with these lung conditions, with breathing problems, the study was actually done originally on bleeders,
bleeders, yeah.
to replace, find something instead of Lasix. And that was very effective, in fact. And so that's a great place to use it. And during that study, incidentally, we found we were just really helping these horses with asthma. So,
That blows my mind.
yeah. So
Like,
then,
that blows my mind.
Yes.
Like, how did they even get there? Like, that's kind of around the bend a little bit. It really is.
You are so right. And in fact, I've been doing this a long time. And if I had met you in the first 5 years of my career, I would have said, hey, doc, avoid the lungs. Don't aim at the lungs. And now we treat the lungs, right? It's
That's
crazy.
I've never heard of that until right now.
Yes.
Never heard of that.
Yes. And so if anybody wants to actually see the research, we have all of those things on our website. And to find a vet that actually offers this shockwave, we have something called Find a Vet, and it lists every vet that offers PulseVet shockwave. So if you are paying for something, know what you're paying for. You know, we can say ask for it by name if you want. We're the company that I think, I have a barn full of horses, right? My friends have horses. And I think we all appreciate that made in the U.S. I think we all appreciate giving back. We're giving back to the industry. It's very important. We're very involved in matching funds for the Professional Horsemen's Crisis Fund, scholarships. We do a lot of programs for young veterinary students and scholarship programs. We think it matters.
Sure.
So.
And you guys are all, like, the scope that you were just talking about, you guys are everywhere in the Western industry, or I keep saying the Western industry, the equine industry. Like,
yes,
you cut a pretty wide swath.
Yes, we're global, by the way. So we are worldwide. Yes, we are the official shockwave, of course, of the NRCHA, and we're so excited to have that title. We are also the official shockwave of the AQHA, the NCHA, the USEF, the World Equestrian Center in Ocala.
I just wanted you to rattle them off.
Yeah, we're in good company, right? Very
Right.
good company. So we're happy to
That's great.
have that involvement. Yeah.
You touched on something here a second ago. I can't just go purchase one of these machines and start doing it out of the back of my horse trailer.
No, sir. Unless you have a vet license.
Unless I'm a vet. Well, I
Yes.
am not a veterinarian.
Yes.
But so I like that.
Yes.
Because then you know that the people that are using it know what they're doing.
Yes.
And know what they're talking about.
Yes. It's medical grade equipment. It's proven to work, but you have to have a proper diagnosis, right? So all of you can buy knockoffs of this everywhere, and they're being sold even for a lot of money. There's actual evidence that some of these things can cause harm, and horse owners don't realize that. Their job is training horses most of the time. It's not so deep in the science, but I want to caution them. Ask some questions. Don't just hand over your checkbook, because you could actually be causing some long-term harm to those horses.
Yeah.
When you have a problem, use the vet.
Use the vet.
Yeah.
Yeah. You've got some new stuff.
We do. We're super excited about this because it's brand new as of 2026.
Oh, brand new.
Brand new to the non-veterinary market.
Gotcha.
So I should say our company is an animal health company. We do small animal and equine. And so I just wanted to make sure you didn't think we're just equine.
Sure.
We do those dogs and cats too.
Absolutely.
Yes, with some other products. This, however, until 2026, you had to be a veterinarian or a medical MD to purchase it. Okay. And I'm proud of our CEO.
So this I can buy.
You can.
Okay.
And we have some here. I'm super proud of Zomedica and the company that now is the parent company for PulseVet Shockwave. Our CEO, Larry Heaton, heard me. I told him it's hard to get large animal vets. We have emergencies on the farm, and we want to be prepared. I have a fire extinguisher. I hope I never use it.
Right.
I think this is a similar product. But this is called Vetigel, and it's a hemostatic. And what that means is it will stop bleeding in about 3 to 5 seconds. So it comes in this little syringe.
Fire extinguisher.
I
love it.
Put one in your horse trailer. Keep one in your tack room.
It's going to happen.
It
Unfortunately, it's going to happen.
Yeah.
There's going to be a piece of wire They're going to get cast in a stall.
Yeah.
Something
silly.
Something silly, and you're going to have blood on your hands.
Yeah.
Every single one of us have.
Yeah.
And every single one of us have had that moment of panic.
Yeah. And if you have to wait for the vet.
It's a big moment of panic.
And if this is your dog.
Oh, man.
I had my dog cut its pad on a piece of ice.
Yeah.
And trying to get that to stop bleeding. It was before I had this, but I would have really liked to have it. The veterinarians have been using this for a long time. The small animal vets use it in a lot of dentals, surgical procedures when they want things to clot and stop bleeding.
Sure.
Equine veterinarians like to use this for inoculations. Unfortunately, if they have to remove an eye or the keratomas, they bleed a lot. Sometimes dentals, removing a teeth.
Sure.
Anything that bleeds, you would like it to stop bleeding, you just put this at the source of the bleed. Maybe while you're waiting for your vet, they can stitch right over this. It's
so they don't have to
safe.
scrub it off.
They
don't,
and it is not causing any harm to the tissue. You know, we used to have things that we'd try to do, and then we sometimes made it worse for the vet to try
Sure.
to stitch it. But this will not cause any harm to the tissue. And sometimes they can just, if they want, they can sew right over it, but it will form a little fibrin matrix, and they can just take it off
Peel
too
it
if
off.
they like. But yeah, so this is a really kind of exciting, cool thing, and I'm really proud of our CEO for bringing this to
That's a cool
everyone.
product. Like you
Yeah.
say, that this is one of those things that we should all just have. And not just because you're sitting here like, it's going to happen. I mean, how many horses this week, or how many horses when we're in Vegas at the finale and there's 4,000 horses, and the most random thing happens.
Yeah.
They slip and they catch a fender on a trailer or whatever it may be.
Right. Even if it's a minor thing, you
Yeah,
know,
just-
a heel grab and then it's bleeding and you can't take the horse in the pen, so this can help you. But if you have a serious problem, you're going to wish you have it.
Yeah.
And there comes 2 in a box, and it has like a 2-year shelf life.
So it'll sit there, so we can throw it in the trailer and just.
Yes, that's right.
awesome.
Yeah. So that's a cool new thing.
That is a cool.
Yeah. You know, I'm going to tell you about one more thing.
Okay, well, come on.
Because I want the horse owners to know.
Okay.
I can't sell it to them, but I want them to know. We have a very exciting point of care stall side product now that the veterinarians really like, and the endocrinologists are talking about it all over social media. And I'm so proud of our team. We have Dr. Ashley Wood, who heads up our research and development, and we have created the first stall side ACTH test, and that we used to call it Cushing's, right? PPID. We now have found a connection with the sports medicine horses. You'd be surprised how many horses may test positive ACTH high numbers, and they correlate often with, there's some published studies, not ours, but they're out there, on suspensory and tendon injuries. And there's a connection.
A correlation.
Yes.
Really?
Isn't that interesting? Because we used to think of it as a geriatric disease, and you would see all the signs of the, non-shedding or the fat deposits where you don't want them, the crusty necks, right? That's just not true. And like any other disease, if you catch it sooner, you will do better and avoid a problem. The other thing we have, besides the PPID stall side testing, so you know in 20 minutes if you should start treating this horse to manage that disease or not. No more waiting days to get the results, and they're very quantitative. They match right up with those results that people have been sending for years. So it's pretty exciting change in science, right?
Sure.
And the other product or assay we have to go with that is insulin. And boy, oh boy, we really are learning that younger and younger horses are affected with insulin dysregulation. And when they are at risk, should they be prescribed a steroid, of laminitis or founder. I say test your horses. This is a simple test your vet can do when they're coming out to do something else, and just make sure that your insulin numbers and your horse's ACTH for PPID is normal, because it could save your horse.
That's interesting.
It's very
It's
interesting.
very interesting how our animal sciences and our human sciences parallel.
Yes.
What's the big thing right now? What's the big thing? Insulin
Yes.
is the big thing right now.
Yeah.
Very cool.
Yeah.
Very
So learn about that or ask your vet. Like, just
Sure.
get those tests done, because it's a simple test.
Yeah.
We pay so much money for our horses and for our tack and for our trailers, and then we overlook a $50 test that could save our horse.
So just sitting here, fortunate enough to get to sit up here and interview a lot of feed companies and everything, and this is where it all kind of ties in. That right there will help you know if you're feeding correctly for that horse.
Absolutely, 100%.
So there's because they can't talk to us.
No.
So that's
and
I've never even had that thought process before.
That's pretty new, right?
Because we do it.
Yeah.
We talk about it.
Yes.
We go get our blood drawn.
Yes.
And they say, hey.
Yeah. Put down the donuts.
Put down the donuts, bro. As you can see, I don't listen very well.
Me either. But
I was over there chowing that cheeseburger down when you came in here. But at least we know.
At least we know.
At least we know. So now, like you say, for $50 test, say, hey, maybe you need to lay off the sweet feed or whatever it is.
Yeah. If we can manage and bring that horse back to good health and avoid a catastrophic problem, why wouldn't we do that?
Yeah.
I think it will probably in the future. Not that far off in the future. It'll probably be part of your spring and fall wellness.
Sure.
And I think it
just
should
do
be.
it. Yeah.
When you're drawing your Coggins every year, let's check those horses' insulin levels. Because we used to think that we could identify them clinically by looking at them, or they had to be 10 years old. That's not true. It's not true at all. Young athletes that look good.
Yeah.
You know, it's quite interesting. So
And then what happens is we stack up a lot of negative things that we don't know, and then all of a sudden that horse that we could have last till he was 18, 20 is done at 12.
Yeah. So that's that's kind of just an interesting new thing on, available to horse owners now to ask their vet about.
Very cool.
Yeah.
Very cool. What you got anything else? I mean,
I think I take it all the time, but I just want to thank you for this opportunity, and I want to thank NRCHA for letting us be part of such a great organization. We're very happy and proud to do that.
Well, Trudy, thank you so much. And I love how passionate you are about this. You've been with this company for a long, long time, and you love these horses. And that's what it's all, the bottom line, right?
That's what we all do. That's why
we're all here. The
bottom
line, that's why this is all passion, 100%. Yeah. That's it. I'm just behind the microphone because I'm not good enough to show. But just you love to be around it. But these horses are so important. So
yes,
I love it. Well, thank you so much.
Thank you so much.
Absolutely. Well, guys and gals, this is what it's all about. Our friends in the industry that take care of us. I love it. The reason these companies jump in and partner with like the NRCHA and these other organizations is for one simple reason. It's for education, and it's for this opportunity to serve you and your horse. So when you go to the vet, just ask them. Yeah. Just ask them. Yeah. Just say, hey, what about this? What about these?
Knowledge is power. Knowledge is power.
So take that. Let these great partners here, the NRCHA and these other great organizations, kind of lead you down and keep your horses healthy and well. Right?
Thank you. Yes.
Thank you so much.
Thank you.
All right, everybody. Well, we've got more and more coming to you. Once again, we're inching closer and closer to tomorrow night in our great finals, and we could not be here if it wasn't for great partners like this. So we'll catch everybody here in a little bit from the EQN Sports Desk, driven by Holiday Auto Group.